Welcome to Advancing Health. In this episode, we hear from a father-daughter physician team who are delivering babies in their hometown, keeping care in the family, and exploring what it means to care for families across generations.
It's not every day you get to practice medicine alongside your family, let alone deliver babies together. Today's guests are doing just that. I'm Julia Resnick, Senior Director of Health Outcomes and Care Transformation at the American Hospital Association. Today, I'm joined by a father-daughter duo from Southwest Health in Platteville, Wisconsin. Dr. Kevin Carr is a family medicine physician who also provides obstetric care, and his daughter, Melissa Carr, has returned to her hometown to practice as an obstetrician and gynecologist. We'll talk about what it's like to work and even deliver babies together and what it takes to provide high-quality maternal care in a rural community. Drs. Carr, welcome to the podcast.
Thank you.
Thanks for having us.
So this episode feels especially meaningful as we think about Father's Day. And the two of you are not only colleagues, but father and daughter working side by side. What has it been like to build a professional relationship alongside your personal one? Kevin, I'll start with you.
Well, it's awesome. It's obviously very exciting to see your daughter do well and to be well liked in the community. She's actually now starting to deliver people that I actually delivered. So I think a fair amount of those has happened. It's also very nice to have somebody very knowledgeable that I can walk down the hallway and ask questions to that I think knows more than I do right now. So it's pretty awesome all the way around.
Amazing. Melissa, what's it been like for you?
Yeah, kind of just to reiterate that, I think it's really an amazing experience. He's such a great role model and just an overall mentor. I mean, he's been practicing medicine here at this location for 35 plus years. So, with that, he brings a wealth of knowledge and all the experience that comes with it. And he's just so willing to offer that advice, both clinically and, from a personal standpoint as well. So, there's just so insightful. And it's like you said, his office is down the hall. So, you can just pop in and, ask questions and bounce ideas off of him. And it's such a nice resource to have, readily available to me. So I take advantage of it as much as I possibly can.
That's amazing. And my dad used to work in the building next to us, so we'd have lunch all the time. But that's different than being in the same profession and actually working together.
And I'll have one more little anecdote. My dad was a veterinarian. And so for many years when I heard Doc Carr, I was looking around because it was my dad they were talking to. And I think Melissa will share that same anecdote that we're used to having that in the background.
Yes. In fact, I had a patient this morning bringing up Doc Carr, who is Grandpa Carr, the veterinarian.
I love that. And I imagine that your dad being in this field influenced your decision to go into it as well.
I was not sure if I was going to do veterinary medicine or people medicine. So obviously I made what I think is a very good choice.
And Melissa, you stuck with delivering babies.
Yeah, same thing. I mean, I had a front row seat to healthcare from a very early age. Growing up, I just remember seeing, number one, you get up in the middle of the night to go deliver a baby or, that side of things. But then, you'd walk into the grocery store or to a ball game and there'd be a patient that would track him down and telling stories about their family members or their loved ones that he took care of and just being, thankful and expressing their gratitude for the care he provided them, So I saw from a very early age kind of how meaningful that was. And I feel like that's kind of a perspective that not a lot of people get going into healthcare if you haven't been exposed to that, especially in a more rural type setting.
Absolutely. So as you've been working together, what have you learned from each other, both as clinicians and as family members? How does that shape how you're caring for patients?
Well, again, to kind of just like, as I mentioned, I saw the relationships that he developed with patients, both in the clinical setting and outside, how patients just felt so grateful for their care. And I got to see how, how he played that role in their lives. And I would just, thought that was really pretty amazing. And so that really kind of impacted, number one, me to go into medicine and then, continuing to build those types of relationships with my own patients.
And Kevin?
Well, I kind of go back to my parents again. I think I was always taught you show up, be there and care for people and the rest will take care of itself. We're a small town of 10,000 and it's just different care out here than it is in the big city because of that. And I think the patients see that.
Say more about that. What makes providing maternal care in rural communities special?
So Our model for maternal healthcare here is a little bit different than what you're going to get in some of the bigger healthcare systems. And we tend to have one provider that follows their patients through their prenatal care, from the first visit through delivery and then postpartum. And so because of that, we really start to build these relationships with patients. You get to know them at a much more personal level. And I just think that brings a whole nother level of care to these moms and babies. So it is a little bit more of a unique experience here. And I think that's part of, what makes us special.
Kevin, anything you want to add to that?
Yeah, I think especially with OB, once you take care of somebody and see them 12, 13, 15 times, they kind of remember you forever, because it's one of the biggest days of their life that they're going to remember for every single day. And you're a big part of it.
Absolutely. And it's one of those few times in healthcare where you're getting care for a happy reason. And it's amazing that you get to be there for them throughout that entire journey. So, Kevin, I know you're an FM who does OB, and Melissa, you're an obstetrician gynecologist. And, how does that work together, working as a care team? And how can those kind of collaborations help improve care for patients?
Yeah, ours, it works amazingly well. We have 5 family practice docs that deliver OB patients, and one of the family practice docs actually does C-sections along with 3 of the OB doctors here. We still take care of our own patients. Obviously, they're very available for any consult, anything that happens. And if a C-section happens on their patient, we're also there first assisting. We're helping out and taking care of the baby. So it absolutely works very seamlessly. There's no turf battles. There's a lot of helping each other out and very willingness to answer questions if there's any problems or concerns about any kind of care.
And we're located in the same building. We're 2 separate clinics or 2 different offices, but we're separated by a hallway. So people will pop into my office all the time just to bounce ideas or ask questions, and vice versa. I'll do the same thing. I'll poke my head in and say, okay, I got this patient, what do you think of this? And everybody is always so willing to help out and, provide advice and, just kind of help coverage. And like you said, it's, we're a pretty well-oiled machine, and it works really well for us.
That's amazing. And in a lot of rural communities these days, we're hearing about hospital closures or hospitals that are having to retract their OB services. But it sounds like you all are doing the opposite of that. So what do you think has been driving that growth, and how are you adapting to meet that need?
So we've seen that firsthand. We had a hospital in a neighboring county close their maternal health services probably about 10 years ago, give or take. And so those patients now had to travel further for their obstetrical care. Many of them do come our direction now. Another hospital, neighboring hospital, has also lost some of their OB providers and their gynecologists, for whether it was from those providers relocating or retiring. So there's just less access to care. And so we have seen more patients coming our direction because of just there isn't as many options available to them, and they're now having to travel further. So to kind of combat that, number one, we've increased our OB providers since I've been here. We have more physicians that are providing OB care, whether it's family medicine physicians and OBGYNs. And we've also opened outreach clinics through our organization. So that's where OB care is available. So people aren't having to drive as far for their prenatal care visits. They still come to our main hospital campus for deliveries, but at least for their visits, they're not having to travel as far.
Fantastic. Kevin, anything you want to add?
Just to show you the numbers, in 2010, we were about 140 deliveries. And I believe this year we're going to be at 240 deliveries. And some of it's the culture of the hospital. The whole hospital has exploded over this period of time. Going back to the American Hospital Association meeting quite a few years ago, we started a Journey to Excellence program after one of the meetings we learned at the Rural Health Leadership Conference. And our hospital does that. And patients that walk in the door from the outside can tell the difference in every single employee, the attitudes, the smiles, the willingness to help out everybody, from the janitor to the CEO. Every single step along the way, every person is important. And it shows in how we take care of patients and how patients respond to what we do. And it's every single one of our sort of different programs, OB, ortho, everything has literally exploded because of some of the things we've done.
That's fantastic and really just speaks to, your organizational culture and how that exudes between providers and also to the people you care for.
And I think there's a lot of word of mouth that spreads too. People are very grateful for their care here, and they really enjoy their experience, and they spread that to their friends, their family members, and so that catches on. And we're starting to see patients that are willing to travel further for their OB care, even if they have options that are closer to home, because they're choosing to come to our facility to come to deliver and coming to see us for their prenatal care.
That is great. And so you've both really been talking about like the human piece of this. And I know a lot of hospitals, including yours, are using technology to help extend care. Can you talk about how you're thinking about incorporating technology into your work?
They are starting to do AI to help with notes here. We just started 6 months ago, so we're learning from many of the providers. There's some very good things about it. There's some things they got to learn, but it sounds like so far so good that it's saving some time, so they can spend more time with the patient and do those things. So that's one of the things they're doing.
And wasn't there a piece about a telemedicine program for neonatology?
Oh, yes. We were the first, and it might still be the only program in the state that has a telemedicine NICU program, neonatal intensive care unit program, associated with University of Wisconsin Madison. And it's been going on for a couple of years. It took us a while to tweak and fine tune some things. And it's really nice in the sense of in our newborn nursery, we have computers set up, we have cameras set up, and we basically call a number, and usually within minutes, we have a neonatologist on the phone. We can see them, they can see us. There's a video on us, there's a video on the baby. And back in the day where we take care of lots of babies who need a little bit of oxygen, need a little bit of help, a little CPAP to help them get through their breathing. You kind of sit there and try to decide, okay, is this baby sick enough to be transferred? Can I watch for another 2 hours? Well, now we make that call right away. And we talk to them and we go, hey, I'm pretty comfortable with this, but I just want to make sure that I'm doing the right thing. And you have them on the phone, they assess the baby, they help you, and sometimes in making a decision, do we order a few tests? And then, hey, we'll keep an eye on things and get back to us an hour. And if the baby transitions and looks great, wonderful. If the baby doesn't do well, then we already have the numbers in and they're ready to send the transport team.
That sounds incredibly helpful for rural hospitals that probably don't see a ton of cases like that.
We also have a new sim lab here as well, so we can run different types of simulations for both physicians and the rest of the hospital staff that are on the OB unit, and that's been really helpful, especially in a rural setting, because our volumes are lower, which also means that our types of high risk clinical scenarios are also going to be lower. So you may have a nurse that might not experience a postpartum hemorrhage or a shoulder dystocia or those types of situations, but have only heard about it. So this allows people to, get that training and doing that repetition through simulation, even if we don't necessarily see it very often, to keep those skills up.
Absolutely. And to close, I just want to bring this back to Father's Day since that's when we're releasing this, and you are a father daughter duo. So, can you just share a moment or a story that reminds you why this work is so important to your community?
I called the patient this morning to ask if I could share this story without saying her name. Obviously, I've delivered a lot of patients, and this specific family, I delivered all four of the girls. Several of them, I believe they're all going into nursing school. And so back in the start of COVID in 2021, she was in nursing school and came to me with symptoms. You just get gut feelings that something isn't right. And I basically did a chest x-ray, and she had an apple-sized lesion by her heart. And I immediately had my nurse call her mom, said, I want her mom here now. I want to get her here before I get my CAT scan. I did a CAT scan. The next day, I got her in with the hospital, the EW hospital, to get a biopsy, and she ultimately had lymphoma. She did take 6 months of nursing school off and is now cured. Now, to add to that story, 3 years later, she wanted to see me, and she was somewhat tearful. So I wasn't sure what was going on until she got here and found out she was pregnant. And she was somewhat tearful because she just is finishing school. She's not married yet, and she's worried, how are my parents going to take this? And we had a long discussion, and I kind of used some old quotes from my former nurse, who was outstanding. and said, this won't define who you are as a human and won't define who you will be in your lifetime. And she asked if she could give me a big hug. And 2 days later, told her parents, and her dad was in tears. He was so excited because 3 years before that, they were worried they're going to lose their daughter. And now their daughter's bringing life into this world. And so it's a huge turnaround, and that's why we go into medicine. Now I'm going to add to one step farther to that. I know her very, very well. I know this family very well. She told me there is nobody else that's going to deliver her baby except for me. Except, unfortunately, that few days I was in Canada fishing. So guess who delivered my baby?
The other Doc Carr?
The other Dr. Carr. And so she got to experience the best of both worlds. And now she had her second baby about 8 months ago. And so I did deliver that one. So she was thrilled that both of us had an opportunity to care for her. And to be blunt, when I called her and asked if I could use her story today, I could tell she was in tears on the phone. She's an outstanding family, just core of the earth people from Southwest Wisconsin.
Amazing. And Melissa, on your end?
One that comes to my mind is, so my very first delivery that I did as a brand new grad, fresh out of residency, was a C-section that I did with my dad. It was his patient, and she needed a C-section, and so I was the primary surgeon, and then he was my first assist. So, looking back, you're eager to do the delivery and be there for your patients, but at the same time, looking back, it was just such a special, cool moment. And now the other really neat thing is that particular patient, she takes care of my kids at daycare. So, I see her every single day when I drop my kids off, and so it comes full circle.
And to add to that story, the grandmother of that patient was an OB nurse here that I have delivered 500 babies with. And so she was in the operating room, and this is 1 a.m. We're doing the C-section. And she thought it was the coolest thing ever that her granddaughter was in there in the room with both of us.
That's amazing. And it's keeping it in the family, both your blood family and your community family. So Doc Carr, thank you both for the work you do for your communities, for sharing your stories, and happy Father's Day to all of our listeners out there.
Thank you.
Thank you very much.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.